So here's the thing with mental health. We need to increase awareness, of course, and we need to also spread the resources. And one way, because there's a shortage of resources, and that might be true for a long time, as we increase awareness, of course, there's more demand. One of the things that needs to happen right away is the revival of group therapy and other kinds of multi-groups, being able to reach more than one person at a time. The idea of psychotherapy, doing one person, one therapist, one at a time, that's pretty out of sorts with the rest of how things are done. And also, it's not necessarily the most effective or the most therapeutic. Now, the only place where they do a lot of, the only place where they do a lot of group work is inpatient. If somebody's in a program, in a mental hospital, or in a dual diagnosis, part-time, partial hospitalization, or in one of those other kinds of programs, then they have groups, okay? But in basically most private practice for sure, and most clinics, most of it, outpatient therapy is individual. It might be a couple. Once in a while it's a family, usually not even families, sometimes couples. Basically most of it is individual. So what can you get in a couple? What can be done in a couple or group therapy? Let me start again. What can be done in group therapy? What's more effective and more therapeutic also in group therapy than in just individual therapy? Well, there's the feeling of support. So a client person who's suffering from X, Y, or Z, let's say anxiety, they meet some other people who are dealing with the same thing. Or people dealing with raising young kids and the whole work-life balance, or relationship issues, or prospects of future employment, anything like that, life problems, diagnostic problems, psychiatric problems, those are better served many times in a group setting. And there's lots and lots of ways to do groups. It doesn't have to just be sitting and talking, although that's good, but there can be all kinds of more experimental kinds of way of doing groups. I ran a very, very unique group program that I created, and it went for 2 years, and it was called ADHD Family Tree. And by family tree, it meant that if your kid has ADHD, it's 90% likely that you do too. So we're not fragmenting the people we're serving. So what we did actually, what I did was created this program that had 4 to 6 families at a time. Groups of families, not just group and not just family, but groups of families. And it wasn't just talking. We would have meals together. We would do theater stuff together. We would do public speaking together. We would do, all kinds of activities together. With the family as a whole and with the kids off with other professionals. So I was able to hire 2 other people and went for 2 years, 10 cycles altogether. And each cycle lasted 4 to 6 weeks. And it was very successful. And it was a real high point of my career, called ADHD Family Tree, or maybe ADHD The Family Tree. And tree standing, by the way, for treatment, I can't remember. Each of the letters stood for something. But it was so unique. I haven't seen it done anywhere else. I would have continued it if I could have found funding for it. It was being funded through some kind of government agent. I think Department of Mental Health was funding it through an agency that I worked at. I stopped working for the agency and I couldn't find another funding source to keep it going. And I haven't seen anything like that since. So the point is that there's all kinds of modalities. There's all kinds of modalities that we're not doing that need to be done. And were, by the way, being done much more frequently 60s, 70s, 80s, maybe even into the 90s, until guess who took over mental health and healthcare in general? Guess who took it over? The insurance companies. And for some reason, the insurance companies don't want to fund these things. They don't want to fund even group therapy by an individual therapist. So I had a group last night, just 3 guys, and one of the 3 guys is a guy in his mid-20s, maybe late 20s, very intelligent guy, very well educated, has a great job, and it was his first time ever having group therapy, a group, just one night of a group. He liked it a lot. And it just shows how people are being ill-served by not being introduced to that much sooner and much more widely. So I'm all in favor of breaking through those boundaries, breaking through the stigma, breaking through the fear of people knowing about each other, you know, that whole individualistic thing that is meant to protect against, you know, to protect confidentiality, which we of course need, but confidentiality can also be in a group, within a group. And of course we did a statement of confidentiality. We did promise trust and confidentiality. That can be done in a group as well as with individuals. So it's time to get back to what really can work more, have more options, more modalities, like was being happened a lot more in the past. So I hope that you will consider this and get active about these things. Get active. And you can always contact me. Thank you. And yeah.